So I'll tell you that fillers, there's a term filler burnout, where people are doing fillers and then they say, look, it's gone. And here's the truth about it. Fillers don't go away, and I'm talking about the hyaluronic acid variety that you think are the temporary ones. Now, of course, there are permanent or semi-permanent, they call, for example, Belafil, which I've had significant problems with, and I would highly recommend you not to use that product. And then there's, of course, Sculptra creates long-term, collagen building. Some people say it's only 18 months, but I believe it's really permanent, minus further aging, right? You're going to still lose volume. Radiesse, people say it only lasts a certain number of years because they hear the FDA clearance. So the FDA says it lasts a certain number of years and it's gone, or a year or two. I don't use really a lot of Radiesse at all. I used some in the past. I found a lot of sort of subcutaneous fibrosis with it, making facelifts more difficult to do. With Restylane and hyaluronic acid therapies, they are things that are nice because they're supposedly just going to go away, causing filler burnout. That's really false. I really have found that to be an absolute falsehood. So I'm not here to sell you fillers. In fact, I think fillers have a lot of limitations. And the key with this is to have you understand they're not temporary. They really aren't. I mean, there's a component that fades, but they really last, and that's really great and it's really bad. And I'll tell you some stories of things where I've heard, and this is the thing, I'm going to do another video on lips, but lips are really problematic. People, I hear, I go every year to do my lip injections with Juvederm or Restylane because it's only supposed to last 6 to 18 months. Absolutely false. And I see these people that they have they don't. I had a lady, I told the story before a week ago, that says, I hate fake lips. Can you put a drop more here? I'm due for it. And she didn't notice she already has fake lips. Her lips look ridiculous. They don't look terrible, but they don't look good. And every time she's adding to those lips, they're getting worse and worse. And I can probably tell you 10 patients just like that I've seen the last week. And so these fillers just accumulate. They stack and they build and they build and they get bigger and bigger. And even of your own great intention to say, look, hey, I don't want to look fake. You're not asking to look fake. Now, there's some people who just want to look fake, and they're not going to be my patients or good patients with mine. But there is a good portion of my patients who say, look, I don't want to look fake, but just give me a little filler because it's going to go away in a year. And this is false. Another story I can tell you is that I had a patient that moved to New York in 2010. She came back in 2022, and she had an MRI in 2021, and she said, the fillers are still there. And I actually saw her, and I could still see the filler. She still looked good. I had another patient that, I do a lot of lip reductions and lip surgeries several times a week to correct overdone silicone lips, and this lady had come in to fix overdone silicone lips, and as I cut on her lip, Restylane squirted out, or some hyaluronic acid of some kind squirted out of her lip. And I said, hey, when did you have a hyaluronic acid injected? And she said, I've never had that, Dr. Lamb, because I stopped my surgery. Because obviously if she just had some fillers done a couple months ago, yes, there's a part that goes down. So I don't want to be operating on someone and designing a lip incision based on something that was done 3 months ago, because yes, there is a component that will go down. I'm not saying it 100% survives, but there is a component that stays. So then she racked her brain. This was in 2018 that I did the surgery, and she said, oh my God, yes, I had 1 syringe of Restylane in Europe. And that, you guys, if you don't know, it was approved in the United States in 2004. So she had it when it was still available in Europe in 1998, exactly 20 years before she had a filler. And I can absolutely tell silicone versus Restylane, because silicone does not squirt out of your lip. It stays integrated into the lip as part of it. It's not a liquid anymore. And so what squirted out of the lip was a clear substance that was sort of gelatinous. It's classic filler. So fillers stay there. The one area that I have really stopped doing that I don't like is under eye fillers. It used to be my favorite area to do, but I've now noticed migration issues of that filler. It typically does not migrate in other parts of the face, but it unfortunately migrates under the eyes due to the orbicularis contracture. So I had a lady that I just saw yesterday who had fillers under the eyes. I don't know how many times actually, but the last time she did it was 7 years ago. It was not done in my office, but I've seen my own patients with this. And her filler started to lump up, and she started to smile, and she saw a ball there. So if you've had fillers under your eyes and you see a ball that shows up over time, and you say, well, it can't be fillers 7 years ago. It was a hyaluronic acid that, if I Google it, says it goes away in 6 to 18 months. It absolutely is there. Absolutely is there. That is the first diagnosis. In fact, how do I confirm it besides dissolving it? I actually have a very advanced ultrasound device that I can actually see the filler. I can actually see it. So unlike just dissolving it, I can actually see it. And so that's one short aside, is that the biggest issue with dissolving is missing the product or over dissolving and creating a hole there. So what I do is I use a dilute dissolve, and I use a cannula to minimize bruising, and I use a very advanced ultrasound device. I have multiple ultrasounds in my office, but this is a diagnostic ultrasound that I can actually see where to go in. And then I target it, and I put a dilute product so I can dilute it over 2 to 3 rounds so I don't create a hole there, although that's still a possibility. So I've really migrated away from fillers under the eyes because it's not a great thing. So really the responsibility of additional filler placement is up to the physician. So I've heard a lot of times patients say, I really forced the doctor to do it, or I told the doctor that it really should be no. It's not the patient's fault. I'll be honest with you. It is the physician's fault for not having the insight, the ability to see when something is distorted, maybe the greed of saying, look, I want more money from this patient, or the artistic ability to see when it's there. So don't think, hey, it's due. It's 6 months. I got the less expensive filler that only lasts 6 months, and I've got to go back and do it again. That's false. So if you said, well, why do filler versus, there's so many things that are out there. I'm not going to talk about all the benefits and risks of fillers and versus fat grafting. I think that would be a great video to shoot on it as a separate one. But this compartmentalized video is really focused on the idea that if you're doing hyaluronic acid and going by the party line that it's going to be gone in a short time, you've got to refill because it's that interval that you are used to, wanting to go back and refill again. Don't. Because it's a dreadful mistake. The doctor has to have the insight to say, look, these fillers that you thought were temporary are absolutely not temporary. And every week I'm looking at patients going, my God, you need to dissolve it. I don't know. Oh, but I think I look fine. And the story that I've probably told 100 times is the patient that came in for fat grafting who was shaking, worried that she's going to look like Meg Ryan. And I said, I hate to break it to you, your face already looks like Meg Ryan right now. I need to dissolve the filler before I do it because I don't put fat in the anterior cheeks that make people look weird. And she's already stacked up like this, and here she is scared out of her mind to look like Meg Ryan, and she absolutely already looks like her. But she didn't have the ability to see when something was off. So this is it is the judgment and the artistic ability of the physician to be able to see this. And so fillers are not temporary. Yes, there's a component that goes down, but they are permanent. So do not think that, hey, it's my time. It's not like an oil change. We have to go back and change it a certain time. Or tires, okay, I got to check my tires. Okay, my tires are good enough. Let's go refill it. You have to have the judgment of placement, and that's the most important lesson of this video.